I'm Erica Munzel, and this is my audience for today. I'm going to be talking about celiac disease. About 1 in 133 Americans have celiac disease. Now that's a big number, but actually, according to celiac.com, only 1 in 4,700 people are diagnosed with celiac disease. Becoming aware of celiac disease can eliminate the possibility of an incorrect diagnosis. What is celiac disease? Left undiagnosed or untreated, celiac disease can cause other major diseases or complications, and doctors and patients look for a cure to eliminate symptoms that you may experience permanently, but celiac disease does not have a cure. It only can allow for lifestyle adjustments to help alleviate the symptoms. Chances are that you or someone you know has symptoms similar to those of celiac disease, but your doctor may misinterpret them for something else. After learning about celiac disease from a friend, I learned that my symptoms matched those of the disease and began the steps of testing and diagnosis. So back to the question, what is celiac disease? Celiac disease is the genetic autoimmune disease that damages the villi of the small intestine and interferes with the absorption of nutrients from food, according to celiaccentral.org. Now, when eating foods that contain gluten or ingesting medicines, vitamins, or lip balms that contain gluten ingredients, you will have a reaction if you have celiac disease, according to NIH.gov. Damage to the small intestine villi can lead to an inability to absorb the nutrients that you need and then will lead to malnourishment. Complications surrounding celiac disease can be diagnosed as other similar conditions or can directly cause other conditions, such as cancer or depression, anxiety, infertility, migraines, arthritis, osteoporosis, thyroid disease, and diabetes, according to celiaccentral.org. Or according to mayoclinic.org, lactose intolerance also, and loss of bone density. Gastrointestinal cancer risk increases 40 to 100 times when you have celiac disease that is left untreated, according to celiac.com. Misdiagnosis or the inability to treat symptoms are common among those with celiac disease because it is so uncommonly thought of despite its prevalence in so many patients. Now, with so many other conditions commonly seen in conjunction with celiac disease, doctors often treat the other conditions without recognizing the true underlying cause of celiac disease. Now, although celiac disease is an autoimmune disorder, it does not usually alter the effectiveness of vaccines, except for the hepatitis B vaccine, according to celiac.org. When following a gluten-free diet prior to vaccination, it will increase the effectiveness of the vaccine, also according to celiac.org. Celiac disease is the immune reaction to gluten that results in the direct damage of the villi in the small intestine and is directly responsible for nutrient absorption. It is important to be aware of common diseases and conditions so that they are in the back of both doctors' and patients' minds when coming up with the proper diagnosis and treatment. Without proper diagnosis and lifestyle changes, celiac disease can hide behind or cause several more advanced and dangerous conditions. Proper diagnosis can allow the patient to alter their diet by eliminating gluten and therefore eliminate their increased risk of cancer, anxiety, other food allergies, and more. Become an educated patient. Do not simply accept whatever your doctor says to you. If there seems to be an underlying cause to the issues that your doctor wants to face head-on, make the suggestion to your doctor of other things. Do your own research prior to visiting the doctor, not as a self-diagnosis, but as a way of confirming what your doctor says, or to give your doctor a suggestion that they may not have thought of. Thank you.